Hey guys, what's up? This is Rohit Bera. I am your osteopathic medical director in the state of Florida. And welcome to Evolutionary Healthcare. We are so happy for you to be a part of our team, and we are changing the face of healthcare in this country and then hopefully the world after that. But Eva is having right shoulder pain that radiates into her neck. And so what we're going to do is fix that. We have been alerted to this by the nurses, and also she's telling us this, and it's really affecting her rehab. So we really want to get a nice, good treatment in to improve mobility, increase flexibility, and ultimately make Eva's life a lot better. So the first thing that we're going to do is, like we really should do for all OMT treatments, because we are affecting the lymphatic system because it is ubiquitous in the whole body, we want to open up the thoracic inlet. So if you have heard this before, bear with me, but it's an important technique and it's really easy and simple, and you should be using it on everybody. So what we're going to do is open Eva's thoracic inlet by depressing her shoulders and having her shrug her shoulders. 1, 2, 3, and relax. And we go down further. 1, 2, 3, and relax. And one last time. 1, 2, 3, and relax. And she should be feeling a nice stretch right along the side of her neck. Is that true?
Yes.
Yes, that is true. Okay, the second thing that I love to do for patients with neck and shoulder issues, and you usually find both of them together. I have met very few people who have shoulder issues that do not have neck issues, and vice versa. So because we are osteopaths and because we are very excellent and comprehensive physicians, we are going to treat the neck and the shoulder. So I like to treat the trapezius, and we're going to do that with muscle energy as well. So a lot of these patients are going to try to fight you when you ask them to push. So you want to remind them that if they are pushing too hard, that we really only need to engage the muscles. We don't need to engage them at full strength. We only need about 10% of your strength, Eva. So please do not break my hand off. But what we're going to do, we're going to stabilize the shoulder, and we are going to lift her head up, tucking her chin to her chest as far as we can go. And once we've reached the barrier, we're going to ask her to push her head back into my hand. 1, 2, 3, and relax. And we can go further. If you guys have students with you or other residents that are helping you, you can have them hold the other shoulder. That would be ideal, but I'm one man and this is the plan. So we're just going to hold one shoulder and push back. 1, 2, 3, and relax. And one more time. 1, 2, 3, and relax. So keeping your head at full flexion, we're going to address either side of the trapezius as well. So first, we'll stretch her right side. So do you feel that stretch? All right, now turn your head towards me. 1, 2, 3, and relax. Very good. And we're going further into the stretch. And again, 1, 2, 3, and relax. Very good. And the third time, push. 1, 2, 3, and relax. Great job. And now we're going to switch hands to the other shoulder and bring her head towards me. And that way we can stretch the left side of the trapezius. So again, push her head back into the left. 1, 2, 3, and relax. Feel that stretch? Yeah. And again, push. 1, 2, 3, and relax. And one more time. Push. 1, 2, 3, and relax. Excellent. Now remember, after every muscle energy technique, the patient is not going to be able to put their head back to neutral or their limb back to neutral. So you have to escort it down to the table. And you only make this mistake once, because if you let go, her head is going to slam back on the table and you will have an unhappy patient. So after you release the trapezius with muscle energy, your patient still might have some trigger points, particularly on the posterior aspect of the shoulder or periscapular. And these are really tough to get, except now you're going to learn this trick, which makes them really easy to get. I learned this when I got a sports medicine fellowship, and I treat a lot of fighters, and they are always having trigger points around their scapula from all the punching they do. And so a really easy way to do it is to find a trigger point or a tender point, whatever you get. How's that? Does that hurt?
Yeah.
All right. So we're going to let her relax down and stay relaxed. And I'm going to take the tip of the acromion and compress this whole shoulder towards the tender point. So my finger remains on the tender point at all times. Although I'm not engaging the tissue, I am just marking that point. And now I'm going to recheck it and see if it still hurts. So does that still hurt now?
No.
No. Fantastic. So what I'm feeling at the point, the tissue was tight and tender, and now it is soft and squishy. And that's what we want. Once we get to that spot, we just hold the compression, and I am actually leaning my body in and not so much using my arm to hold her shoulder down. Because if you do this for 20 patients a day, like we all do, your arm's going to get tired, and then no one's going to stay to treat you, or no one's going to be able to treat you, and you're just going to be miserable. And of course, we want all our docs to be very happy at Evolutionary Healthcare. So after a couple minutes, like maybe 1 to 1.5 minutes, I'm feeling a therapeutic pulse at that site where I'm monitoring with my left hand. So that indicates to me that this treatment is basically done. We've accomplished the goal of improving blood flow to that spastic muscle, thereby increasing nutrient delivery, increasing waste removal, and because I'm doing all the work, the muscle is not doing any work, and therefore it's getting a paid vacation. So I'm going to let my pressure off of that, and I kept my finger there because this works so well. Lots of patients think that I'm not testing the same spot. So we're going to check it, and how is that?
Feels good.
Feels good. All right, awesome. So that is a money trick for anywhere on the trapezius or around the scapula. You will thank me so many times, and it's so easy. And now you don't have to figure it out like I did. Another really common area of pain is the biceps tendon around the shoulder. So again, we can have our patient make a muscle, thank you, and we'll follow that biceps to its origin. And lots of times people have a tender point right there. Does that hurt? Mm-hmm. Yeah. So what we'll do to fix that is much like we did for that periscapular tender point, we are going to pick up the tissue and wrap it around that point. So this time I'm going to take her proximal humerus and compress it medially around my monitoring finger. And of course after that I've got to ask her, does that still hurt?
No.
Good. And I had a feeling she'd say no because I told her to. No, I'm just kidding. It's because that is soft and squishy now. So once you feel the texture, the tissue becomes soft and squishy, you can almost bet that it doesn't hurt anymore. So that is a principle that you can use anywhere in the body, but it works especially well at the shoulder. And so what we're doing is we're holding the tissue and the shoulder up ourselves. We're not putting pressure on the monitoring finger. We're just keeping it there to make sure that she believes us when the pain's gone, when we're done. Because from a patient's point of view, we're really not doing much. So they don't believe us that we're testing the right spot. So one of the other things you can do with this technique is fine-tune it by turning this whole tissue clockwise or counterclockwise, and you can see that it moves much easier counterclockwise, or actually this is clockwise, whatever, you see it on the screen. Whichever way it moves easier, you hold it there, and that improves the release of this muscle spasm or tender point or whatever it may be. So now I feel a therapeutic pulse at the point, And we are going to slowly and gently release the tissue. And we're going to recheck that point. How does that feel? Any better?
Better.
Better. All right. Very good. So again, you find a tender point, you wrap the body around it, and you hold it. You fold and hold. That's all you got to do. And lo and behold, a lot of those pains will go away. This will help your patient in rehab tremendously. However, I'm going to show you another trick that is also money for plateauing patients in rehab, especially obviously shoulder rehab. So one of the things that physical therapists typically overlook is the clavicle, and specifically the SC joint. So what we need to do is make sure the SC joint is functioning properly, because that clavicle is the only attachment to the shoulder, from the shoulder to the axial skeleton. And if it is not working properly at both the SC and the AC joints, the range of motion is going to be really restricted. So first we're going to treat the SC joint. We're going to treat it two ways. We're going to treat an adducted clavicle, and we're also going to treat a horizontally extended clavicle. So first, an adducted clavicle would be one, and normally I just treat each clavicle both ways, just to make sure that we are covering all our bases and get some real movement in that joint. And it works wonders. So what we're going to do is we are going to warn the patient that this is going to be unpleasant, and apologize in advance, but they're going to feel much better afterwards. So what we're going to do is pull inferiorly on the clavicle at the SC joint, and we're going to adduct our patient's arm. And what we're going to do is have her gently push her arm down against our hand. So bringing her wrist to her hip. Perfect. 1, 2, 3, and relax. And we take up the slack, and that starts to hurt, and I'm so sorry, Eva. And push again. 1, 2, 3, and relax. Very good. And one last time. 1, 2, 3, and relax. Perfect. Okay, and then again, we take our patients back to neutral ourselves. We actually got a click at that SC joint, which is a great sign that we put the clavicle back in place. And the second way to treat the clavicle is as follows. We are going to walk around to the other side and this time we're going to push posteriorly on that clavicle. So now we're going to fix a horizontally extended clavicle by having the patient grab my neck from the other side of the table. I'm going to lift up her scapula, and I'm going to push inferiorly on the clavicle at the SC joint. And I want her to pull me down. 1, 2, 3, and relax. And I'm going to increase everything, so the pressure, the scapula, and she's going to pull again. 1, 2, 3, and relax. And one last time. 1, 2, 3, and relax. Take it to the final barrier and let it go. The last thing you need to do to treat the clavicle, and look, we've got a nice red mark here, so we're getting a lot of blood flow to that area, which is what we want. The last thing we need to do is treat the AC joint. Have our patient turn their head away from the shoulder, rest their hand on their chest, and I am going to engage the AC joint right here by pushing cephalad through the humerus right towards the AC joint. Once I reach a barrier, I'm just going to give a slight push through, so a gentle HVLA technique like so. And that pops that AC joint right back into place. And now typically what happens is that our patients will try, and then I ask them to test their shoulder out, and they are much more free in their movement, particularly above their head. It's a lot more pain-free, and so this is a movement that they could not have done before, you started working on the clavicle, but now the rehab is going to go a lot easier. So that is how I would approach a patient with neck or shoulder issues either on one side, and ideally you want to do it on both sides. And I will tell you why. Because more often than not, both shoulders are messed up. Both clavicles are messed up. But you only uncover one being messed up when you optimize the other one. So Eva just told me that now you can tell that the shoulder I treated because the other one doesn't work as well. So in real life, I would treat the other one as well. So quick and easy. It's going to really help them for rehab. It's going to really help their daily function, and it's going to reduce their pain, and you're going to be a hero. Every day you will be a hero. Thank you so much, and looking forward to meeting you soon.